Hi everyone, my name's Mick and I'm here to talk to you about health and safety. The CQC inspect and rate services in 5 key areas, which are safe, effective, caring, responsive and well led. Health and safety is a key element in each one of the 5 key areas inspected. Here are my top 10 tips to support you to be rated as outstanding regarding health and safety. Tip number 1. Ensure that your risk assessments are detailed and person-centred. These should not be generic and could relate to a variety of topics, including moving and handling, nutrition and hydration, pressure area care, and falls. Do you have a Legionella risk assessment? Are there risk assessments in place for people regarding any risk to choking? There may also be risk assessments for a variety of activities that the person takes part in. Tip 2. Make sure you have relevant and up-to-date policies and procedures in place. Are they accessible? And do staff understand and use the policies and procedures? Do the policies and procedures clearly outline what action they should take, and do they know how to carry it out? Tip number 3, staff training. Do staff complete an induction which includes shadowing more experienced members of staff? As a minimum, care workers should complete training in health and safety, including moving and handling, safeguarding, fire safety, the Mental Capacity Act, and where appropriate, medication and food hygiene. How do you know that staff are confident and competent in their roles if regular supervisions are not completed? Tip number 4. Are there contingency plans in place for unforeseeable events such as fire, flood, gas leak, or lack of water supply? Do staff know what to do in these situations? Do they understand their responsibilities in the event of food poisoning or a diarrhea and vomiting outbreak? Do they know who to notify and what to do? Tip number 5. Are investigations into staff concerns, safeguarding, accidents and incidents thorough and well documented? Are the appropriate notifications made to the CQC when incidents occur? Do staff know what to report and to whom? And are patterns and trends identified and acted upon to improve safety to people? Tip number 6. Can staff confidently demonstrate an understanding of medication administration, infection control and pressure area care practices? These are key safety issues which staff must be able to understand and put into practice. Tip number 7. Is equipment and our services checked and maintained regularly? This can be anything from annual boiler safety checks to PAT testing. Are lifts serviced regularly? Are water temperatures checked? Are annual services completed on hoisting equipment and fire safety equipment? Tip number 8. Are you able to explain how the staffing levels were decided? Is there a staffing model based on the dependency of the people using the service? Are there sufficient staff at night? Make sure you have a response to these questions and something that shows the decision-making process. Staffing levels cannot be left to chance. Tip number 9. Ensure that audits are complete, analyse the results and take the appropriate action. What is the audit telling you? Are there any emerging patterns or trends? And what improvements can be made? Who is responsible for taking the appropriate action and what's the impact on people? And tip number 10, fire prevention and protection. Do you have a fire risk assessment in place? Do you have fire alarm systems and equipment that is checked regularly? Do staff know how to use fire extinguishers, fire blankets and evacuation sleds if required to do so? Do you have person-centred personal emergency evacuation plans in place for the people at the service? Do you carry out regular evacuations to ensure the measures you've put in place work in practice? If you have any questions on anything we've discussed, please call us on 0345 844 1111. Thanks for listening.